In today's important talk, we will discuss the role of HBOT in treating idiopathic sudden sensorineural hearing loss, or ISSHL for short. ISSHL is defined as an unexplained hearing impairment greater than 30 decibels at 3 consecutive frequencies, developing in less than 3 days. It occurs in one or both ears. In a 2023 paper entitled, quote, Sensorineural hearing loss as a complication of COVID-19 and the COVID-19 vaccine, unquote, by Hurt et al., they wrote the following. Hearing loss is the most common sensory deficit globally. In 2023, the World Health Organization reported that more than 1.5 billion people live with hearing loss. Population studies on the prevalence of hearing loss in the U.S. indicate that it affects approximately 23% of individuals aged 12 or older. Furthermore, older adults experience a higher prevalence and more severe forms of hearing loss compared to younger adults, unquote. In the U.S., it is estimated that there are 27 cases per 100,000 adults and 11 cases per 100,000 children. Adults in their 40s to 50s and older are the most common ages. There's an equal rate for men and women for this issue. Most cases are in one ear, and 2% of the cases people have in both ears. 30 to 60% of these cases spontaneously resolve. Idiopathic means relating to or denoting any disease or condition which arises spontaneously or for which the cause is unknown. The cause of ISSHL can be unknown or multifactorial. Some of the causes include viral infections of the inner ear, hypoxia, autoimmune diseases, blood circulation problems, cochlear membrane rupture, ototoxic drugs, head injuries, abnormal tissue growth, or biochemical changes. COVID-19 has been thought to be a possible cause of ISSHL, but the evidence is limited and the causal relationship is unclear. In the 2023 paper entitled Sensorineural hearing loss as a complication of COVID-19 and the COVID-19 vaccine by Hurt et al., they wrote the following. In addition to the more well-known manifestations of COVID-19, otolaryngologists have noticed an increase in the rate of new sensorineural hearing loss cases in the context of a COVID-19 diagnosis and COVID-19 vaccine administration. The exact nature of this relationship remains largely unknown, unquote. Management of ISSHL includes early intervention along with a multifactorial, multidisciplinary approach. Therapies include high-dose oral corticosteroids, intratympanic corticosteroids, and hyperbaric oxygen therapy. An intratympanic steroid injection is a procedure where a corticosteroid medication is injected directly into the middle ear through the eardrum. The eardrum is also known as the tympanic membrane. Hyperbaric oxygen therapy, or HBOT, reverses idiopathic sudden sensorineural hearing loss, ISSHL, primarily by hyperoxygenation. HBOT involves breathing 100% oxygen at increased atmospheric pressure, promoting higher oxygen levels in the bloodstream and tissues, including the cochlea. HBOT also decreases inflammation, promotes the creation of new neurons, and enhances the effectiveness of steroids. The cochlea is the organ of hearing in the inner ear that translates sound vibrations into electrical impulses. The inner ear's auditory structures, especially the hair cells within the cochlea, have a high metabolic rate and are very sensitive to a lack of oxygen. Studies show that HBOT is most effective when started as early as possible, ideally in the first 2 weeks of the onset of the symptoms. It is recommended to combine HBOT along with corticosteroids when treating ISSHL. The protocol for HBOT is 10 to 20 sessions of 90 minutes at a pressure of 2 to 2.5 atmospheres absolute, or ATA. There may be benefits in getting up to 3 months of HBOT care. For patients with idiopathic sudden sensorineural hearing loss who do not recover with initial oral steroid treatment, the 2 primary salvage therapies are hyperbaric oxygen therapy and intratympanic steroid injections. The specific protocols vary, and both are most effective when initiated as soon as possible after initial therapy fails. The Medical College of Otolaryngology Head and Neck Surgery Foundation in the 2019 guidelines do recommend considering HBOT as an optional salvage therapy within 4 to 6 weeks of onset of hearing loss. Effectiveness is time dependent, decreasing with delay. So it's important to get in as soon as you can. One physician, Dr. Olga Aguilera, MD of Santa Barbara, California, who I just recently saw speak about this subject this last weekend, saw 24 people so far this year with ISSHL. She found that HBOT was effective even though all the patients started after 4 to 12 weeks of the onset of the symptoms. So how do you find a clinic that has a chamber that can do 2 to 2.5 atmospheres? Contact the International Hyperbaric Association by either phone or email and request the name of a clinic near you. Or you could Google hyperbaric oxygen therapy. When I Googled hyperbaric oxygen therapy near me, I found that some of the clinics listed have only mild chambers, or sometimes no chambers at all. And you're not looking for a mild chamber. Mild chambers are only FDA cleared to 1.3 atmospheres and would not deliver the pressure necessary for this medical emergency. Also, I came across 2 hospitals as I did the Google search which would have the chambers that could help with this medical emergency. But the question is, can you get the referral to said chamber along with the insurance coverage approved in a fast enough time? Remember, this is a time-sensitive medical emergency. When my father suddenly lost all hearing in one of his ears a couple years ago, I did not yet have our hard chamber, so we had to refer him to a physician. This experience taught me just how slow the process can be to get referred and approved to get into your local hospital's hyperbaric chamber. We now have 2 hard-sided high-pressure chambers, and we will do whatever we can do to accommodate the needs of someone that has experienced ISSHL. ISSHL is a time-sensitive medical emergency. Prompt diagnosis and treatment are crucial for the best chance of hearing recovery. Hyperbaric oxygen therapy is recommended as an adjunctive therapy, especially in cases of severe hearing loss. When treating ISSHL, HBOT is more effective when used in combination with corticosteroids. Hence, collaboration with an ear, nose, and throat physician is recommended for comprehensive care. If you have any questions, please feel free to leave those in the comments section below. Also, if you have any suggestions for future topics, you can leave those in the comments section below. To learn more about our clinic, see our website listed in our description below. As always, it's been a great pleasure to talk with you. I look forward to talking with you on our next video.